Hi, I'm Dr. Lynch. One of the questions I get asked frequently about stellate ganglion blocks are, what if I don't have a stellate ganglion? I've heard that some people don't have a stellate ganglion. How do I find out if I have one before I want to do a procedure called the stellate ganglion block? It's funny, it comes up all the time. People ask me this question, so I hope a very simple explanation will help answer that for you. It turns out that it's more of a terminology issue than anything else, but it is true that about 20% of the population are not born with what we call traditionally a stellate ganglion. I think it's important to differentiate that that's a terminology issue and that the procedure called stellate ganglion block is not really affected by that. So that's probably the most important thing. A ganglion is just a cluster of nerves in the side of the neck, and some people are born with two ganglion, cluster of nerves that are fused together, and when that's the case, we call it a stellate ganglion. Sometimes the two clusters of nerves are slightly further apart, and we call them something else. But the connections are the same, the location's the same, and when we block them with an anesthetic, the same effect happens. So in this case, a picture is probably worth 1,000 words, so I just want to draw your attention that there are variations in the side of the neck, and the important thing is, along the side of the neck, there are two cervical sympathetic chains, and they connect all of the sympathetic fibers between the brain and the body, and they come together in this anatomic funnel. Again, there are a lot of variations here. So some people are born with a traditional stellate ganglion. Stellate means star-like, so it has branches that come off, and they travel to different important parts of the body and the brain. The stellate ganglion is down here at the C6, C7 level. There's a smaller ganglion here called the middle cervical ganglion, and then there's this guy up here called the superior cervical ganglion. And all of them are places like along a train track where there would be like a train station where signals can jump off and travel on another branch. The variation that some people have, which is over here on the left side, what I'm demonstrating here on the left side, is again the same thing: a superior cervical ganglion, a middle cervical ganglion, and then instead of having one fused ganglion like this, some people are born with two slightly different ones that are essentially stuck next to each other. This one we call the first thoracic ganglion. This one is the inferior cervical ganglion. But guess what? They still have the same connections as this version here, which is a stellate ganglion, that travel to the different parts of the body that are important. The key is when we block this, what we're doing under ultrasound guidance is steering a needle directly into this location, and we're bathing that area with ropivacaine, a long-acting anesthetic. All that does is shut down all the signals here in this area. And it's the same whether you have two little ganglia separated, sitting next to each other, or one like that. That's pretty much it. So I would feel very comfortable if anybody says something like, well, you gotta be careful, you don't have a stellate ganglion. I don't think it's clinically relevant, and I feel very comfortable saying that as long as the procedure is performed properly and the anesthetics is delivered to the right area, it'll be the same effect. I hope that helps.